Fellows, and I'm a senior resident at Mount Sinai-Beth, Israel. And I'm going to be talking to you guys about femoral nerve blocks. I wanted to thank my residency for sticking with me for the past 3 years and usually not judging me at all the stupid things I do. And I want to thank all NYC for giving me the opportunity to be up here today. For any of you that are interested in academics or education in the future, the fellowship is a fantastic opportunity, and I really advise you guys to consider it. So, like it or not, this is probably the most common trauma that you guys are going to see in your emergency department. You have an elderly patient coming in, they fell, their leg is shortened, externally rotated, their x-ray looks something like this, and you're thinking to yourself, well, I gotta do something about this patient's pain. I have an entire armada of pain medicines that I can give to the patient, all of which come with very significant side effects. But of course, for hip fractures, we have ultrasound. We can do something called a femoral nerve block. Shout out to Sinai-Beth, by the way, whose website I stole this picture from. They're a fantastic learning resource for any of you guys that are interested. Femoral nerve blocks are excellent short-term analgesic solutions and interventions for somebody that's going to get a definitive intervention later on. The most important thing I want to point out is this little doohickey called the ultrasound. Very important in your femoral nerve block. So, quickly about peripheral nerves, they look like this. There are a bunch of nerve filaments wrapped in 3 layers of connective tissue that give a honeycomb type appearance in axial view and a filamentous type appearance in longitudinal view. When you look at it via an ultrasound, they look something like this, and they're a little bit difficult to find. And the reason they're a little bit difficult to find is because all peripheral nerves exhibit something called anisotropia. And what anisotropia is the property of being directionally dependent. Now, what does that mean when it comes to peripheral nerves? Well, if you have your ultrasound probe in position 1 right here, perpendicular to the skin, your peripheral nerve is going to look an awfully lot like all the connective tissues around that peripheral nerve. But if you take your ultrasound probe, alter it, put it in position 2 perpendicular to the nerve, your peripheral nerve is going to look a lot more honeycombing, like this picture down here. Now, in the anesthesiology literature, they list a number of different needles that they can use to perform peripheral nerve blocks. But we're not anesthesiologists, we're in the ED. The honest truth is we're going to use whichever needle our ED stocks and carries. And the honest truth is that for femoral nerve blocks, whichever needle you use isn't really going to matter. It's not going to matter what the tip is because you're not going to be getting anywhere close to the nerve itself. What you're going to be aiming for is this connective tissue sheet around the nerve. Injecting anesthetic into a nerve causes sensory, motor deficits, can cause paresthesias, some of which may last for a very long time. So do not inject into the nerve, inject into the sheet surrounding the nerve. Now, the local anesthetic that we are most familiar with in the emergency department is lidocaine. You all know that the max dose before toxic effects is 4.5 mg/kg and lasts for about 2 hours. You add 1% epinephrine to that, you increase your max dose to about 7 mg/kg, and that lasts about 4 hours. But the anesthetic that is most commonly used for peripheral nerve block is bupivacaine, because the dose that you can use is smaller, and the effect of its anesthetic is longer. If you add epinephrine to it, bupivacaine can give you anesthesia in the femoral nerve region for about 8 hours. Plenty of time for you to get orthopedics on board, admit, and have your surgery. So, the important thing you guys need to know about local anesthetics is they do cause systemic toxicity. They usually cause systemic toxicity in a dose-dependent form, and generally, neurotoxic events precede cardiotoxic events. A key exception, bupivacaine in some cases can cause cardiotoxicity without preceding neurotoxicity. So if you're ever doing a femoral nerve block, you want to make sure that you have patients on a monitor and you have a neuro exam preceding the nerve block itself. And so this is where you're going to get access for your nerve block, and every one of you is very familiar with this femoral triangle picture because it's where you do your femoral central lines. You're just going to remember your mnemonic from medical school and go a little bit more lateral rather than medial. On a cross-sectional view of the femoral triangle, you're going to look something like this. And the most important thing, remember how I was telling you about that connective tissue sheet? There's this convenient sheet called the fascia iliaca, which covers the iliacus muscle, that envelops the femoral nerve right here. And this space is what you're going to be aiming for on your femoral nerve block. In ultrasound view, the fascia iliaca is less prominent, But you always want to make sure to alternate your ultrasound probe and fan it out so you can see this fascia right here. This is the femoral nerve, and you're aiming your 10 to 20 cc's of local anesthetic, again, in this spot right here. And now, in gift form, your needle path is going to come above the iliacus muscle, under the fascia iliaca, and you're going to start with 1 to 2 cc's of local anesthetic into the region just to make sure you're under the fascia, and it's going to envelop your femoral nerve. We're going to replay it one more time for those of you that weren't watching it or on your phones. So again, needle path right here, under the fascia, right there before you hit the femoral nerve. You inject, make sure everything's nice and dandy, and it's going to envelop your femoral nerve. 10 to 20 cc's of local anesthetic. And then your patient's going to be right as rain. Shout outs to music therapy. Big takeaways. 1, femoral nerve blocks are excellent short-term analgesic tools for patients that are going to get a definitive intervention. Use your ultrasound probe. Aim for the nerve sheath and not the nerve itself, and beware of local anesthetic toxicity. Thank you very much for listening.